Hi, this is Sarah and Chris, and we're gonna do a quick CVP setup just as a video for anybody who's interested in learning more about CVPs. And over here we have all our supplies ready right there. And the first thing that we're gonna do is we're gonna spike the NS bag with the IV tubing that's located in the transducer kit. And then we're gonna make sure that all the connections are tight. And you can use a 500 mil NS bag, that's perfectly fine.
So I'm gonna go ahead and spike our bag here and make sure I can get out as much air as possible. Some nurses have just different techniques to this. I'm gonna go ahead and spike it while it's upside down. For me, it's gonna be the easiest way. And then I'm gonna squeeze the bag to help me get the air to the top. I'm gonna unclamp. And to prime the line, I'm gonna pull the little blue tail here on the IV tubing. That's gonna help me get the air out of this bag. So you can slowly see the air disappearing from the top of the bag. Sometimes you have to turn the bag side to side. And there's one more air bubble. I might be able to get it. Here we go. And that'll just help me with getting an extra accurate reading. Okay, so I'm gonna go ahead and prime the rest of my line. And I've just got it into the bag here, and I'm holding it upright, and I'm pulling the little blue tail again to let the saline run through all of the IV tubing. If you need an extra set of hands, you can definitely ask a colleague to help you. Sometimes it can be a little tricky at first.
You can see the line is being filled right now.
Okay.
It's really important to get all the air out as much as you can.
Okay.
And then the next thing we're going to do, we can go ahead and hang it, and then we're going to make sure we prime all the side ports to clear out any air. And we're going to be doing that also with the blue rubber tab.
Okay, so in your transducer kit, you've got some extra supplies here. I'm going to go ahead and open it. Again, some nurses are different with what they like to use, but I'm just going to take these two out and use these ones for right now to help me prime. So, as Chris said, we're going to be priming these two ports to make sure all of the air is out of the tubing. So you can see here, there's an off label. I'm going to turn the off label down. So now what's open is this L. I'm going to go ahead and take off this port. I'm going to pull the blue so that saline runs out. Hopefully you can see that dripping. So that looks good. I'm gonna go ahead and grab one of my caps and place it on there. And now I'm gonna go back to the off position. Now I remember that I've done this one because I've changed the cap to blue.
And what kind of caps are those? Are those vented or non-vented caps?
Non-vented.
Those are non-vented caps.
All right, let's prime this one down below. Same technique again. Off position, I'm gonna go down. I'm gonna take this cap off. And I'm gonna use that blue tail again, pull it to let the saline come through. And then I'm gonna grab my second one that came in the kit already, the blue. I'm taking off the white part and I'm putting it right back on there and turning the position again.
So now the next step is going to be putting on the pressure bag to get that set up. And we're going to be inflating it to about 300, and you'll be able to tell when you get there because you will see the some of the green on the pressure bag nozzle.
So we have the bag here. I'm going to put it into the pressure bag sleeve, which has a little blue hook inside that I can hang it onto. The pressure bag has a valve as well. Let's see which way we need to turn this. And I'm gonna inflate, you'll see as Chris is filming, this nozzle come down as the pressure increases.
So you can see the numbers start to pop up right now, and it's extending out.
I'm gonna use two hands because I'm not quite as strong. And there's the green, if you can see it there.
Perfect. So now we'll go ahead and clamp that off. Excellent. So now what we're going to do, we're going to set up our transducer holder. And we're going to be using this clip and the clamp right there. And we're just going to set it up right now. We might make some adjustments when we're actually in the room. And we got the transducer clip here.
Let's see. Forget how this one goes now. Oh, here we go.
And you'll have to use those screws to screw it down. And then the next thing that we'll do is we will put in the clip here into the transducer holder. It can be a little bit tight at times, so sometimes you have to wiggle it in and pop it in there.
Mm-hmm. That might be.
And I think actually we might have to flip it.
I think so. Not quite sure on that one.
All right, so now we're in the patient's room and we're going to continue the second part of the setup here. So we have our CVP set up on the IV pole. And what we're going to do, Sarah is going to be checking in for the phlebostatic axis. Okay, looks good, nice and level. The phlebostatic axis is at the fourth intercostal space, which is a reference point for the right atrium. You want the transducer to be lined up as closely as possible to this spot to ensure the best readings, so you can use a carpenter's level to make sure it's accurate. To the Philips monitor. And then we'll connect the other part of the cable to the transducer line. And now what we'll do is we'll check the monitor to make sure that it's set up. So the CVP line will come up automatically, but we also want to check the labels. And right there we see that the label is CVP. If it wasn't labeled CVP, we want to change that, otherwise the waveform might not come up. It might be labeled as an arterial line if the patient just came in from the ICU.
I'm going to come over to my patient now, and I'm going to be connecting to her central line. You can see on this central line she has 3 lumens. They're labeled, it's very small text on there if you can read it. We want to use, in most cases, the most distal port. That's usually going to be your brown port.
So right now Sarah's going to be checking the patency of the line. It looks like we have good blood return.
Might flush that one more time.
Well, after flushing the line a second time, we can now connect the line to the patient. And we'll make sure that the line's unclamped.
Next part, now that we're all set up, we're going to want to zero our line. So this is going to our patient. So I'm going to turn, you can see the dial has the label off. I'm going to turn it off to my patient. I'm going to take off the cap. It's open to atmosphere. I'm going to come up to my monitor here and click on the wave. And I'm going to zero CVP. Click. And you'll have to be patient. It takes a good few seconds. It's saying CVP in process right now. When I hear that second beep, I know CVP 0 done at 11:15. I'm going to grab a new sterile cap to put back on. And I'm going to turn this into the open position so that it's reading. The off is to the port. Now we'll come up here to look for our waveform. I'm going to do a optimization of the scale. So I'm going to click on this and go optimum scale. And I'm going to do a flash flush test to see how accurate my setup is. I'm going to do that by pulling this blue tail here. So it's just a little pull.
You put that into the pot, the frying pan. Because you don't want it super watery.